Hello, my name is Nancy and we're here today for your total joint replacement class. We want to welcome you here to CHRISTUS Santa Rosa Health System. Thank you for choosing us for your joint replacement surgery. We're excited you're here and excited you're here today for the class. Our presenters today will be registered nurses, dietitian, and a physical therapist from the rehabilitation services. Our surgical sites include CHRISTUS Santa Rosa Alamo Heights, CHRISTUS Santa Rosa Medical Center, CHRISTUS Santa Rosa New Braunfels, CHRISTUS Santa Rosa San Marcos, and CHRISTUS Santa Rosa Hospital Westover Hills. The purpose of this class is to review your preoperative instructions, tell you what to expect during your hospital stay, and what to expect when you go home. And we're going to give you the strategies for the best outcomes for your joint replacement surgery.
Hi, I'm Erin. I'm going to go over some information regarding your pre-admission testing. A couple days before your surgery date, somebody from the pre-admission testing department is going to call you to set up an appointment. At this time, we're going to get any necessary lab work, EKGs, x-rays, anything that you might need to prepare you for your surgery. When you come in, you'll also fill out all your admitting paperwork. So you'll go to the admitting desk, make sure you bring your identification, your insurance card, and they'll get you squared away there at that admitting desk. You will also meet with a registered nurse at this time. We are going to go over your medical record, your medications. This is a great time for you to either bring your actual medications or bring a really detailed list of all your medications so we can get that all charted down. You're going to receive pre-op instructions at this time. This is going to include really important information of how to prepare you for the day of your surgery, including some cleaning wipes for your body, and we'll go over more of that in a little bit. In preparation for your surgery, we want you to notify your primary care doctor, any specialists that you see, of your plan to have surgery. They might need to go over some information with you, do any further testing with you in order to have you ready for your surgery. Please bring all your valuables at home on the day of your surgery, but we do ask that you bring any cases you might have for your glasses, your contact lenses, your dentures, anything like that, please bring that. Please also contact your surgeon immediately if you show any signs and symptoms of illness prior to your surgery. Sometimes physicians make changes to your medications prior to your surgery date. Please follow any changes that your physician makes specific for you for your surgery date. We also ask that you abstain from smoking for 24 hours before and after your surgery date. During your pre-admission testing appointment, we're going to go over some information of how to prepare the night before surgery. This night is really important. We're going to give you some cleansing wipes or solution, something like that, to clean your body with the night before surgery. We will give you detailed instructions as this step is very important. We also ask that you sleep in clean bed sheets, clean pajamas this night before surgery. Don't shave the surgical site prior to surgery. Don't eat or drink anything after midnight unless your doctor has instructed you so. Also, at the point that you've done your cleansing wipes to your body, we ask that you don't apply any lotions, creams, perfumes, anything from that point on. On the day of your surgery, we ask that you present to your same admitting area where you did your pre-admission appointment. We want you to bring any home equipment that you use at home that you might need following your surgery. CPAP, BiPAP, any sort of assistive devices like crutches, walker, anything like that. We also want you to bring a list of your current medications. Although we've already gone over that list with you at your pre-admission appointment, we want to make sure we have everything marked down. Any personal items you might need the day of surgery and for your stay after. Favorite blanket, pajamas, also your cell phone, your charger. Make sure you bring your charger. When you check in for surgery at the admitting desk, you've already done the admitting process, so it will be a little more quickly done. You will be escorted from that point on to your pre-op area. While you're in pre-op, we are again going to review your medications with you, any allergies you might have. We will also start your IV. This will be a good chance for you to ask any last-minute questions. You'll meet with your surgeon, your anesthesiologist at this time. And once your pre-admission time is done and you're off to surgery, we will escort your family member back to the waiting room to wait until your surgery is completed. After your surgery is completed, the surgeon will come out and talk to your family member and update them how everything went in the surgery. Once your surgery is complete, you will go to the recovery room, which we also call the post-anesthesia care unit. At this time, you will stay there for about 1 hour. We are going to address your pain here in the recovery room and get you fully awake until you're ready to go up to your room. This is your pain assessment tool. You will see this at every step of the process. We are going to frequently ask you your pain level. We want to agree upon a number that's compatible for you and comfortable for you. Pain is natural with any surgery, so our goal here is to get you to a comfortable level that you can tolerate. We want you to be able to participate in your physical therapy, your post-care, all with comfort. And if we address your pain, we can help you get there. So we are going to ask you to set a pain goal each day, and it's something that's realistic for you that you think you can manage. We want you to comfortably perform your daily activities. We want you to not have any trouble sleeping. Breathing deeply shouldn't be a problem, and coughing should also not be a problem for you. There are many different treatment options, medications, and treatments that your surgeon can prescribe for you for your pain management.
Hi, my name is Sandy Roberts. I'm one of the dietitians in the CHRISTUS system, and today we're going to be talking about the importance of nutrition as you get ready for your surgery. So these are the topics that we're going to briefly discuss. We'll talk about what a healthy diet looks like before and after surgery, and in a little bit more depth. We'll talk about the importance of protein. We'll talk a little bit about supplements, vitamin and mineral supplements particularly. And for those of you who have diabetes, we'll talk about the importance of maintaining good blood sugar control. And then lastly, a subject that no one likes to talk about, and that is constipation. What should you be eating as you're getting ready for surgery? We would encourage you to make sure that you're consuming enough protein, and we'll talk a little bit more about this in a minute. Eat plenty of fruits and vegetables. Also, be careful of those empty calories. Empty calories means that these are foods that don't have much nutritional value, but they may contribute to excess calories, and that can cause a problem in terms of weight control. Also, make sure that you are consuming foods that are good sources of calcium and vitamin D, and again, we'll talk a little bit more about that. And then, of course, maintaining a healthy body weight, which you may want to talk about with your doctor. And then adding a multivitamin supplement. Again, we will talk a little bit more about that. And then if you have diabetes, making sure that you keep your blood sugars in good control. After surgery, it will be important to continue to eat good sources of protein to promote healing. And if your appetite is not good, make sure that you're eating small, frequent meals. It is so important for you to eat well to promote healing that you want to make a point of eating even if you're not hungry. And then making sure that you include high fiber foods, and again, we'll talk more about this when we talk about constipation. And then making sure that you're adequately hydrated. So whether that's water or tea or coffee or other beverages, preferably not sugar sweetened beverages, make sure that you focus on getting at least 8 8-ounce cups of fluid every day. And if your appetite is not good, you may want to add an oral nutrition supplement, and there are many on the market. Why are we taking time to talk about good nutrition? Nutrition is so important for you to have a healthy surgery and recovery. We know that because of many studies that have been done in the past, that people who are well nourished are more likely to do well after surgery and have a speedy and safe recovery. So what does a healthy diet look like? A healthy diet includes foods from every food group, and you've probably heard about the food groups before. So from our fruits and vegetables, we encourage at least 2 servings of fruit every day and 3 to 5 servings of vegetables every day. Fruits and vegetables are a great source of vitamin A and vitamin C, both of which are important in the healing process, and they're also a good source of fiber, which can help with constipation. They're also a great source of something that we call phytonutrients. And if you've not heard that word before, phytonutrients, phyto means plant. These are nutrients that we find in our fruits and vegetables in particular that can really help keep our immune system strong. And of course, our immune system is what helps us to fight infection. So those fruits and vegetables are such an important part of maintaining a healthy immune system. If we move over to the protein section, protein, of course, is important for wound healing and also good immune system functioning. Many of the proteins that we eat are also good sources of iron, which can help prevent certain types of anemias. And then on the far side, we have our bread group, breads and cereals. And unfortunately, our bread group often gets a bad rap, but breads, cereals, rices, pastas, and things like that are a great source of carbohydrates. And carbohydrates are our body's most important source of fuel. So if you do like your carbohydrates, like I do, the key is really to make good choices. So choosing foods that are high in fiber or high in whole grains is really the key. And the recommendation is to get at least half of your servings from this group from whole grains or high fiber foods. How many servings do you need a day? Well, that really depends on your level of activity, but usually a minimum of about 6 servings every day, which often sounds like a lot, but a serving is like a slice of bread or half a cup of pasta or rice. The last thing I want to mention about this group is that it is a really good source of many of our B vitamins. There are so many reasons why it is important to make sure that we are consuming those foods that are high in carbohydrate, but just making good choices is really important. Let's move over to our fat group, another group which people are like, I don't want to eat too many fats. And that is true. You don't want to consume too many fats, but the key here is to choose fats that are heart healthy, like olive oil, canola oil, nuts, seeds, nut butters, and things along those lines. Also, we find fats in some of our fatty fish. So things like salmon and tuna and mackerel. Again, a good protein source, but also a good source of fats. Why are fats important? Fats help us to absorb our fat-soluble nutrients, vitamin A, vitamin D, vitamin E, and vitamin K. And as we mentioned before, vitamin A is really important in the wound healing process, and vitamin D serves a lot of different functions. So we want to make sure that we're including those heart-healthy fats to help us absorb those nutrients. And also, quite honestly, fats carry flavor, and we want to make sure that we enjoy the foods that we are eating and enjoy the flavor. So including fats, the heart-healthy fats, in frugal quantities is really the key. So fats are important, but just don't go too overboard with them. And then lastly, our dairy foods, things like milk and yogurt and cheeses. These foods are a great source of calcium and also protein. But the downside with this group is that they can carry a lot of extra fat, particularly saturated fat, which can raise cholesterol levels. So if you're a person who really enjoys your dairy foods, make sure that you're choosing low-fat or fat-free options in this case. And the recommendation is actually to have 2 to 3 servings of dairy foods every day. If you do choose dairy alternatives because you're lactose intolerant, then make sure that the foods that you choose are good sources of calcium. So let's talk a little bit more about protein. Protein is so important for wound healing, and there are lots of different ways that you can get protein in your diet. Protein is not only important for wound healing, but it is also very important to make sure that our immune system is working properly and providing us with the ability to fight off infection. So where do we find different foods that are good sources of protein? Because we want to try to include them in every meal. We can find them in, of course, the obvious sources that most people know: beef, chicken, fish, pork, eggs. But we can also find them in our soy products. So if you are a vegetarian, you can get great protein from soy. We also find protein in our beans and peas, so things like black beans and pinto beans and things along those lines, navy beans, all those good legumes. As I mentioned before, we find them in our dairy foods as well. So a glass of milk or Greek yogurts are great sources of protein. Things like cottage cheese are also good sources of protein as well. So even if you're not a meat eater, or perhaps if you've kind of lost your taste for meats of different types, you can still get great quality protein to help maintain your immune system and help to promote wound healing from lots of different sources. So do make it a point before and after surgery to try to have a good source of protein at every meal. Now, supplements is another controversial topic, and that's what patients will often ask me about is, should I take a supplement or not? One of the things that we do know is that as we get older, our ability to absorb vitamins is not as good as when we were younger. And so in addition to eating a lot of nutrient-dense foods that we've talked about, it may be helpful to consider taking a multivitamin. And you may also want to talk with your doctor about whether it would be appropriate for you to take a vitamin D supplement or a calcium supplement. So that's a good conversation to have with your physician. If you have diabetes, maintaining good blood sugar levels is going to be absolutely essential to promote wound healing. So I would encourage you to work with your care team to work on your blood sugar control before you have surgery. And then, of course, watch those blood sugar levels after surgery very carefully. If your blood sugars are elevated, it's going to increase your risk for infection. So work with your care team to make sure that your medications have been tweaked. And of course, watch your diet and make sure that you are watching your carbohydrates and not including a lot of those empty calories, the cake and cookies and pies and things that we do enjoy, but can certainly affect our blood sugar levels. Lastly, I want to talk about constipation, and this is something that nobody really wants to talk about, but we really need to talk about it because when we're in the hospital, where our activity level may not be the same, and after surgery, we may be requiring some pain medications, there are lots of reasons why we could develop constipation. So I like to talk about the 3 pillars of preventing constipation, and that is fiber, fluid, and activity. So making sure that we are consuming an adequate amount of water or fluid is very important. And I know that many people focus on water, 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 and of course water is the best choice, but if you are also consuming things like tea, unsweetened tea, and beverages that preferably aren't sugar sweetened, those will all help with your fluid intake. Fiber, and we find fiber in lots of foods. We talked about fruits and vegetables, our legumes, or those dried beans and peas, which are also a good source of protein. They're a great source of fiber. And of course, there are many cereals on the market that are great sources of fiber as well. And of course, you may be needing a fiber supplement as well. So that would be something you may want to talk with your doctor about. But the goal is to consume at least 25 to 30 or more grams of fiber every day. And that can be challenging to do if you're not consuming some sort of fiber, higher fiber foods with every meal. So again, pay attention to that fiber and the fluid, and then as allowed by your care team, your physical therapist, make sure you're moving your body. The last thing you want to do is sit, 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 sit all day long. So please make sure that as you're progressing after surgery, that you are moving. So the goal of having this surgery is to allow you to be able to move better and to move without pain. So take advantage of that in the future and make sure that you are exercising because not only does that promote healthy body weight, but it can also promote good movement, if you will, of your gut too. So pay attention to all of these different things, fiber, fluid, and activity, and those will all help you on the road to recovery. Thank you very much, and I would encourage you to look at your diet very carefully as you're getting ready for your surgery. And those of you who might be watching who are caregivers, you need to take good care of yourself too. But see if there's just 1 or 2 things that you could tweak with your diet to help just make it a little bit better. Thank you very much for your time.
name is Ellis. I'm a physical therapist with CHRISTUS Santa Rosa, and I'm representing your rehabilitation team. Today I want to inform you about what you can expect from rehabilitation services after your surgery and what we should expect from you. It truly is a joint effort together, making sure that you get the best outcome from your surgery and have an enjoyable experience at our hospital. One of the objectives of rehabilitation services is, of course, early mobilization and walking. We want to get you up as soon as possible. And here we see the goals for rehabilitation. You can expect to get out of bed early. In fact, you should expect that we will get you out of bed on the day of your surgery. You will be seeing a physical therapist, certainly, and in some cases, if the doctor orders, you will also be seeing occupational therapy. If you come up to the inpatient floor late and physical therapy isn't there, you can expect to at least get up and stand on the day of surgery by nursing. We want to teach you to be able to transfer with the use of assistive device, to be able to get up safely and use that assistive device, and of course to be able to ambulate or walk using that assistive device. If you need to ascend and descend stairs in your home environment, we will teach you how to do that using either handrails or an assistive device. We need you to understand the importance of progressing in your rehabilitation. Obviously, the day of your surgery will not be the end all, but there needs to be a progression. You're going to get better and better and better, and that needs to be modulated, your physical progression, with your pain level. Your body will tell us how we should proceed, and it is important that we work together in you getting the best outcome. If you have precautions, some will not, we want you to understand what those precautions are. Those precautions are the do-nots, what you shouldn't do to protect your surgical. Then we want you to be able to safely perform your activities of daily living, either independently with the help of an assistive device or with help from your care partner. And also, we want you to be confident in your home exercise program. When you go home, to know what exercises to do, to know how to continue to progress in your rehabilitation. These are some of the common exercises that you will be doing after surgery. Ankle pumps are simply just moving your feet back and forth, allowing blood to pump into your legs. This also helps with prevention of blood clots. Gluteal sets is simply with your legs straight, squeezing your buttocks muscle and relaxing. We have hamstring sets down here. With the legs slightly bent, you see there's a roll underneath your knee. You're going to press your heel into the bed or into the surface, tightening up the back of your thigh muscle, which is your hamstrings. And here we have quad sets. The quad set is being done on the straight leg, where you're pushing the back of your knee into the bed, tightening up your thigh muscle. Straight leg raises, an important one here, where your leg is straight and you're lifting it straight up. Bridging knee extension. Your leg is up and gravity is working on your knee to keep it straight. We have a short arc quad here, where again there's a roll underneath your knee and you are straightening, extending your knee, tightening it, and then lowering it. Then you have a long arc quad. Same thing, it's a knee extension, but it's done sitting either in a chair or at the side of the bed. Knee flexion. It is important to gain mobility back in your knee, bending it. So you sit and you pull your heel backwards, flexing your knee. Then we have just a drop and dangle knee flexion, where you're just sitting on the edge of the bed and gravity again is pulling your knee into the bent position. What is important in all of these exercises, and these exercises are primarily knee specific. Hip exercises are very similar, but there are some that you won't be doing because of the hip surgery. Fall precautions, very important. After your surgery, because of anesthesia and the process, the weakness of your muscles and the joint because of your surgery, you're at a high risk for falls. So even if you feel confident, we implore you, do not get up on your own. Please use the call button and call clinical staff, or have your care partner or family member call clinical staff to help you whenever you need to get up, whenever you need to go to the bathroom. It's important. You may feel like you can do it, but we don't want you to fall. When you are able to move on your own and you can walk ad lib, your physical therapist or your surgeon will let you know that that is the case. Possible precautions. Depending on your surgery, you may have some precautions. Normally, you will be weight bearing is tolerated on your surgical limb, but in some cases, the surgeon may require that you have limited weight bearing, and we will instruct you in how to do that. Also, for hip surgeries, depending on how the surgery was performed, you may have certain hip precautions that you can't do, such as bending more than 90 degrees at the hip, turning your foot inward, or crossing your legs. These are all common hip precautions that your physical therapist will instruct you in. We want you to have the best outcome that you can have with physical therapy.
I'm Mia, I'm a registered nurse here, and I'm going to be talking about transferring to your hospital room. So you've had your surgery, you've been into recovery, and now you're ready to come up to the floor. So at this point, family and friends are able to come visit. The number of people will depend on COVID guidelines at the time. And we'll also be able to feed you. So typically we'll start you off with clear liquids. Depending on how you do with that, then we'll progress you as tolerated. So you'll go from clear liquids to full liquids, and then usually to whatever you were eating before you had your surgery. We'll also have hourly rounding. You'll have a whiteboard in the room, and we'll update that with communication items. So it'll have your nurse, the CNA, whoever the charge nurse is, pain medication, and when it's next due, and it'll have phone numbers and any other information that you need to know will be on that board. Physical therapy will also be up to get you up and moving. Usually we do this within a few hours after surgery. If physical therapy isn't there at the time we get you up and out of bed, the nursing staff will get you up and moving. Hand washing and use of hand sanitizer is super important to prevent infection. So if you notice that anyone isn't adhering to this, just give them a gentle reminder, hey, use the hand sanitizer before you come into the room. Depending on the surgery or the surgeon, there may be various types of equipment that you have in the room. One of these things for everyone is going to be a vital sign monitor. So once you get up to the floor, since you just had surgery, we're going to be monitoring you pretty closely. So we're going to be doing vitals at different intervals. Usually we'll do every 30 minutes for an hour, and then every hour for 2 hours. So about 3 hours you'll be hooked up to that, and then we'll go to the standard 4 hours. You may also have IV fluids or antibiotics. Typically, if you're able to eat and drink, you don't need to be connected to the IV fluids the entire time. The antibiotic that I see used most often only goes over a few minutes, so we'll run that antibiotic and then we'll disconnect you. If you have a Foley catheter, we try to remove that as soon as possible. So we may remove it almost as soon as you get back from the surgery. If not, we'll take it out the next day. There may be different drains, just depending on the type of surgery that you had done. It could be a wound vac, it could be a Jackson Pratt drain, but that is also a possibility. There's also on-cue pain pumps that we sometimes use. Those go directly into the surgical site and insert an amount of local pain medication. Sometimes we also have cryotherapy or polar ice that's used, and that's essentially just Velcro that wraps around the surgical site and just does ice continuously. You may also have AV boots or SCDs. Those compress and essentially squeeze your legs to help keep the blood flow going. Anti-embolism stockings, those super, super tight things that we put on while you're under typically, so you won't have to deal with getting those actually on. But usually we'll do thigh-high stockings so that we can help prevent embolism, blood clots, that type of thing. And it's set of spirometer. If either nursing or respiratory therapy, we'll go over that with you. It's going to be essentially taking really deep inhales, holding it, and then breathing out. And that is going to be able to help prevent you from getting pneumonia after your surgery. If you had hip surgery, you may also have an abductor pillow, and that's going to keep your hips in a neutral position, keep you from crossing your ankles to prevent any dislocations. So the next day after surgery, our focus is to basically get you on your way to going home. So like I said previously, if you have a Foley, we're going to be taking that out. So you'll have to be getting up either to the bedside commode or walking into the restroom when you need to go to the bathroom. You'll get up at least twice a day with physical therapy or nursing staff to get up and walking in the halls. We want you to get up and sit for all meals, but if you do get out of bed or need to get out of bed, make sure you call for help so that nursing staff can assist you out of bed. You just had surgery, we don't want to add a fall on top of that. Depending on your home medications, we may resume some of those, or we may hold off on some of them just depending on what the medication is. That'll be decided by the physician. So do make sure that you bring an accurate list of your medications before your surgery. We also may start you off on anticoagulant therapy, again, to help prevent blood clots. This might be baby aspirin, it could be Lovenox, which is injection. Sometimes I've seen Xarelto used also. So now we're going to talk about discharge planning. So you're either ready to go home or possibly to a skilled nursing facility or rehab. So typically we get you either home or to a different facility within 2 days. If you go home, you might have outpatient home health or therapy services. And that will be something that case management and the physician kind of determine. And also physical therapy, occupational therapy will make a recommendation depending on their evaluation with you. Make sure that you have a support system at home. Obviously, even if you're really mobile after surgery, there may be things that you still need assistance with. If you have a dog that you need to walk every day, probably not something you'll be able to do. So try to ensure that you have things set up before you go home. There are a lot of advantages to being able to go home directly after the surgery, which include lower risk of infection, and a lot of times you're able to heal faster and better. So if you do go home with home health, you might expect 4 to 7 visits from them, just depending on how you're doing. And if you have home health that works with you with therapy, then you may also transition to having outpatient physical therapy or occupational therapy, just depending on what your needs are. If you're not safe to go home directly after the surgery, sometimes we'll send you to a skilled nursing facility or a rehab facility, and typically you'll stay there 7 to 10 days. After your stay at rehab or a SNF, you'll go home, and just like before, you'll have home health or outpatient physical therapy, just depending on your progress. Now we're going to talk about some complications after the surgery. So one possible complication is blood clots. This usually won't happen because you're not getting up and moving around as much, and you're not having as much circulation going. So prevention for that are those stockings, the TED hose that we'll put onto you during or shortly after surgery. This is another reason that we want you to get up and move as much as possible. Not trying to run any marathons, but definitely want to stay active. That'll help keep circulation going. And the blood thinning medications, depending on what the physician prescribes. Infection is also a possible result after surgery. So it's really important for you to make sure that you're looking at that surgical site every day. So if you notice that there's redness, swelling, anything oozing out of it, especially if it's a nasty color, any bleeding, fevers or chills, swelling around that leg or either one of your legs, or an increase in pain. Once you get home, it's important to follow all hospital and surgical directions as we give them to you. If you do have any questions, make sure that you contact either the surgeon or the hospital. Continue your exercises and walking as prescribed by physical therapy. While you're here in the hospital, physical therapy will teach you a lot of different exercises that it's important for you to do to keep that joint mobile and also to prevent blood clots. Make sure that you have a good support system, so that's family, friends, neighbors assisting you with activities, and also making sure that you're taking your medications as prescribed. Typically, you'll have a follow-up with your surgeon within 1 to 2 weeks. It's very important that you make sure that you go to this follow-up appointment. And you'll also have follow-up phone calls after the surgery, and those are to check in on you before you have your follow-up appointment with surgery, and to see if you need any assistance in between, and maybe if we need to get anything else ordered, whether that's different types of therapy or whatever your assistance needs may be.